After age 70, 7 signs your pancreas is in danger. Do not mistake them for common digestive issues. Did you know that the pancreas is one of the most vital organs for both digestion and blood sugar control? Even though it is only about 6 to 8 inches long and tucked away behind your stomach, it quietly performs 2 critical jobs every single day. First, it produces enzymes that help break down fats, proteins, and carbohydrates. Second, it creates hormones like insulin and glucagon to regulate your blood sugar levels. Unfortunately, when the pancreas starts to struggle, the early signs are often very subtle. Bloating, indigestion, mild abdominal pain, weight loss. These symptoms are easily confused with a basic stomach ache or common digestive troubles. Because of this, many people do not seek medical advice until the condition has already progressed. After the age of 70, the risk of pancreatic issues tends to increase. This includes things like pancreatitis, pancreatic insufficiency, and pancreatic cancer. This does not mean that every symptom indicates a severe illness. However, recognizing these warning signs early gives you the best chance for a timely diagnosis and effective treatment. In today's video, we will explore 7 warning signs that your sign number 1, upper abdominal pain that radiates to the back. This is one of the most common symptoms when something is wrong with the pancreas. Many people describe the pain starting in the upper abdomen, right below the breastbone. It then slowly spreads toward the back. Some feel a dull ache. What is unique is that this pain sometimes has nothing to do with physical movement. It can appear after a meal, especially one high in fat. Some people find that leaning forward while sitting down helps ease the discomfort. Meanwhile, lying flat on their back often makes the pain feel worse. This is quite different from most muscle or joint issues. Of course, upper abdominal pain can also be caused by gastritis, gallstones, but if the pain persists, keeps coming back, or travels to your back, do not just reach for over-the-counter antacids. Getting the right diagnosis is crucial. Sign number 2, loss of appetite and unexplained weight loss. You are eating the same as usual, you are not on a diet, you are not trying to lose weight. Yet, within just a few months, your clothes start to feel loose. Your friends and family notice that you have clearly thinned out. This is a sign that should never be ignored. When the pancreas does not produce enough digestive enzymes, the body struggles to absorb nutrients. You might be eating enough food, but Additionally, many pancreatic conditions cause a loss of appetite. You feel full much faster. You simply lose the desire to eat. For older adults, this weight loss is especially concerning because it often includes the loss of muscle mass. This increases the risk of falls, reduces mobility, and slows down recovery from other illnesses. If you lose more than a few pounds in a short period without a clear reason, be proactive and see your doctor. Do not assume that losing weight is always a good thing. In your later years, unintentional weight loss always needs an explanation. Sign number 3, oily stools that float and are hard to flush. This is a very specific sign, yet many people are too embarrassed to talk about it. When your pancreas is healthy, its enzymes break down the fat. If these enzyme levels drop, fat goes undigested. As a result, your stools may appear oily or greasy. They may have an unusually foul odor. They might float in the water, or they may stick to the side of the toilet bowl and be very difficult to flush away. Many people think it is just because they ate something greasy that day. But if this happens regularly, do not ignore it. This is a sign that your body is failing to absorb fats. Not only does this lead to weight loss, It also causes a deficiency in fat-soluble vitamins like vitamins A, D, E, and K. Over time, this can impact your vision, bone health, the immune system, and blood clotting. If you notice a significant change in your bowel movements that lasts for several weeks, talk to your doctor. Do not be shy about discussing these symptoms. They provide vital clues for a diagnosis. Sign number 4. Sudden spikes in blood sugar or a new diabetes diagnosis. Many people are unaware of the deep connection between the pancreas and diabetes. Inside, these cells produce insulin, the hormone that moves sugar from your blood into your cells for energy. When the pancreas is not functioning correctly, its ability to produce insulin can be compromised. The result is a rise in blood sugar levels. Many people over age 70 are suddenly diagnosed with diabetes, even though their blood sugar was always normal before. This does not mean everyone with diabetes has a pancreatic disease. However, if diabetes appears suddenly, especially alongside weight loss, abdominal pain, or a lack of appetite, doctors may look closer at the pancreas. You might also notice constant fatigue or blurred vision. These are all symptoms related to high blood sugar. If your blood sugar is becoming increasingly difficult to manage despite following your treatment plan, tell your doctor. Do not adjust your medication on your own. Finding out why your blood sugar is changing is the most important step. Sign number 5. Persistent nausea and bloating after meals. You only eat a very small portion, but your stomach constantly feels bloated, uncomfortable. You are burping a lot, you feel nauseous, you might even lose your appetite just looking at food. Many people immediately think it is a stomach problem. And it is true that these symptoms are common with gastric issues, but they can also happen when the pancreas is not doing its job. When food is not digested properly, the process of emptying the stomach and absorbing nutrients is disrupted. Patients often feel full almost immediately. Eating just a few bites makes them want to stop. If this continues, the body will eventually run out of energy. Muscle mass will decline, the immune system will weaken. For those over 70, this is particularly worrying. Losing even a small amount of weight unintentionally can increase the risk of falls and make it harder to bounce back from an illness. If these digestive issues last for weeks and do not improve with diet changes or basic treatments, get checked out. Do not just treat your stomach while ignoring the rest of your digestive system. Sign number 6. Chronic fatigue and a growing... Fatigue is an incredibly common symptom. It can be a part of many different health conditions. Because of this, people often brush it off. When the pancreas is underperforming, your body is not just failing to digest food, it is failing to absorb energy. If this goes on, you might feel constantly drained. You wake up tired, a short walk leaves you wanting to sit down. You lose interest in the activities you used to enjoy. Many people assume they are just getting old. But if this exhaustion comes with weight loss, changes in your stool, or persistent belly pain, it is time for a full checkup. One very important thing to remember: do not try to mask this fatigue with extra coffee, energy drinks, or unverified supplements. If the cause is an internal health issue, these quick fixes will not solve the problem. In fact, they might delay the discovery of the real illness. The body rarely sends out signals for no reason. Listening to these small changes can help you catch a problem much earlier. Sign number 7. Unexplained yellowing of the skin and eyes. This is one of the most critical signs and is something you should absolutely never ignore. Many people think yellowing is only related to liver disease. In reality, certain pancreatic conditions can also cause this. The head of the pancreas is located very close to the common bile duct. If there is inflammation, a tumor, or any abnormality pressing on that duct, when that happens, bilirubin builds up in the bloodstream turning the skin and the whites of the eyes yellow. This condition is known as jaundice. At first, you might only notice a slight yellow tint in your eyes. Later, your skin color will change too. Some people also experience dark-colored urine, pale or clay-colored stools, persistent itchy skin, weight loss, and a loss of appetite. It is important to remember that jaundice is not a disease itself, but a major warning sign. It can be caused by liver issues, gallbladder problems, or pancreatic issues. If you or a loved one notices any yellowing that was not there before, see a doctor as soon as possible. Do not buy over-the-counter remedies or wait to see if it goes away. In many cases, early detection makes a world of difference in treatment. Factors that increase the risk of pancreatic issues after age 70. Not everyone has the same level of risk. Certain factors can increase the likelihood of developing pancreatic problems. The first factor is age. The risk for many conditions, including pancreatic ones, naturally increases as we get older. The second factor is smoking. This is a proven risk factor for many serious illnesses, including pancreatic cancer. If you smoke, quitting will benefit not just your pancreas, but also your heart, lungs, and blood vessels. The third factor is diabetes and obesity. Maintaining a healthy weight and managing your blood sugar protects your heart and reduces the strain on your pancreas. The fourth factor is chronic pancreatitis. Anyone who has had repeated or long-term inflammation of the pancreas needs regular monitoring by a physician. The final factor is family history. If several members of your family have had pancreatic issues, make sure to tell your doctor. This information helps them assess your risk more accurately. How to protect your pancreas after age 70. The good news is that many risk factors can be managed. First, maintain a healthy weight. Excess fat, especially around the midsection, is linked to metabolic disorders. A balanced diet, combined with appropriate physical activity, offers many benefits. Second, keep your blood sugar under control. If you have diabetes, take your medication exactly as prescribed, check your levels regularly, and keep your follow-up appointment. Third, limit alcohol consumption. Heavy alcohol use over a long period can increase the risk of pancreatitis and other health issues. Fourth, do not smoke. This is one of the most impactful changes you can make for your overall health. Fifth, do not ignore unusual symptoms. Do not assume that persistent bloating, weight loss, or abdominal pain are just part of aging. Getting checked early always increases the chances of successful treatment. Finally, while not every pancreatic issue shows up on standard tests, routine exams allow your doctor to evaluate your overall health. They can spot abnormalities in blood sugar, liver function, or nutrition. In conclusion, the pancreas is a small organ that plays a massive role in digestion and blood sugar management. Unfortunately, pancreatic conditions often develop quietly and are easily mistaken for common digestive issues. Today, we have looked at 7 warning signs that the pancreas might be in trouble. Upper abdominal pain that radiates to the back, loss of appetite, and unexplained weight loss. Oily, floating sudden blood sugar spikes or a new diabetes diagnosis. Persistent bloating and nausea after eating, chronic fatigue and weakness. The most important takeaway is this: do not diagnose yourself. These symptoms can be caused by many different things, but if they persist, recur, or happen all at once, early detection offers far more treatment options than waiting until a condition has progressed. Thank you for taking the time to watch this video. If you found this information helpful, please share it with your friends and family, especially those in their 60s or 70s. Helping others recognize these early warning signs can save lives. Do not forget to like, subscribe, and hit the notification bell to stay updated with our Senior Health series. Disclaimer: the content in this video is for informational and educational purposes only. It is not a substitute for professional medical diagnosis, advice, or treatment. If you are experiencing unusual symptoms, severe abdominal pain, jaundice, rapid weight loss, or any concerning signs, please visit a healthcare provider immediately for proper evaluation and care.